I'm pharmacist Kevin Hope, and welcome to 5 Minutes with a Pharmacist. Today, we're excited to bring you a bit of an international version of this series, and I'm here today with Dr. Barabara Roper. Now, Dr. Roper is currently working with the U.S. Army, but she is working with the U.S. Army in Germany. And we were just talking a little bit about COVID-19 and kind of how things are different there in Germany versus here in the United States. So, Dr. Roper, fill us in. What's going on over there?
Well, we've been on a lockdown, and we've been on a lockdown since December, probably a little bit more stringent than what's been going on in the US. They closed all non-essential stores, except for the essential ones like grocery stores, pharmacies. And so going forward, you can get takeout food, and that's about it. So we're looking forward to maybe a little bit more businesses opening up here in March sometime, but we have to wait till the Prime Minister kind of makes some changes.
Right, absolutely. So certainly a big effort for us all around the world, and you've had your hands on some of this in your clinical practice there with the U.S. Army. So tell us a little bit about the work you do from day to day.
So as a clinical pharmacist, I work with the primary care team, and I see a lot of their patients that need more follow-up, do a lot of diabetes education and medication adjustments. I also work with hypertension, some vaccinations, and I've been kind of a proponent of the COVID vaccine. And as I tell people, I'm from the polio era, and we just kind of got vaccines.
Right, absolutely. And so, as you start your career and you think about how you started and how things evolved, you weren't our traditional pharmacy student. You weren't right out of high school, starting into college and decide, hey, I'm going to become a pharmacist. It was a little bit later in life. You started your career in finance. And so take us from how you went from a career in finance to now the clinical pharmacist for the U.S. Army here in Germany.
Oh, well, it was a little bit of a different road than most of my classmates, but I had been in a meeting with the head of the SBA because I was in finance, and I was at a luncheon, and she spoke about doing more for SBA loans for the underserved population. And that kind of piqued my interest in what I was doing to kind of contribute to the underserved. And I thought about it, kind of long and hard. And then I had been interested in healthcare early on and had thought about that when I first started college after high school. And I just decided, well, pharmacy was a great field. It was just kind of on the start of the real change where there were a lot of, need for pharmacists, increasing number of schools. So I went back. I had a bachelor's degree, but I had to go back and do a few refresher classes. Applied, and then 4 years in a residency with my classmates. It was a lot of fun. It was different, it was challenging, but it was a good experience, and I'm glad to be a pharmacist and do what I do now.
So that's wonderful. A big career shift, obviously, kind of there from finance to pharmacy. What advice would you have for somebody who's maybe on the fence and thinking about, well, I really want to do something else in life, but I feel maybe kind of stuck where I am. Obviously you have made big changes and come out on top. And so what advice would you have for people?
I would say shadow, go and talk to people that do that job. Ask them if you can have the opportunity to learn a little bit more about what they're doing and what their day-to-day work includes. I think that's probably one of the things that I did, that I kind of got a good perspective. I asked kind of people that worked in the retail establishment as well as in a hospital. And what I found was that as a pharmacist, you can work in a lot of different settings. There's so many different settings. You can work in a home office for a pharma company. You can work in a hospital, an outpatient setting. You can work for retail. There was a period of time where I worked in specialty, and that was very exciting. I did a lot of calls to patients on the phone. There wasn't any video or anything like that. We really just did a lot of teaching, getting new starts for Humira and Enbrel for Crohn's and rheumatoid arthritis. And that I kind of got a knack for that, learning and how to do that Now we have more video and things like that. So maybe that was a little preface to what we're doing right now with COVID.
Absolutely. So one final question, and that being, what message would you have for pharmacists out there in kind of terms of what gets you, what drives you, what makes you excited about going into work, and kind of what advice that you might have for other pharmacists who might be just starting out or might have been in a career for quite some time and just are looking for that incentive of, to keep going, to keep pushing forward, especially in COVID, as we're talking about all of the challenges and um, the workload can be overwhelming at times.
Mhm. So with COVID, it has been a bit challenging here because we had to split the outpatient pharmacy into a team. So I actually kind of got pulled into one of those teams and had to split up my clinical time with the outpatient pharmacy. But I kind of utilized that interaction with patients at the outpatient pharmacy to kind of find other patients that could use my help. And recently I had a patient who had some diabetes that was not well controlled. And so with an A1C that was a little bit high, I mean, 10 is kind of high. So I took the opportunity to kind of say, hey, make an appointment and we can see what we can do to help you. I think that's the greatest reward, is that if you help one small person, if you do one small thing to help one person, that's a big reward. For me, it is. And I think as pharmacists, we can get a lot of stress. A lot of things are going on with COVID and changes, but recognize that there is that one little thing that's the reason that you went into pharmacy, and it is a reward.
It is. Well, thank you so much, Dr. Roper, for joining us today. And thank you all for joining in for 5 Minutes with a Pharmacist.